Welcome everyone to Ben's Den. I'm Pranam Ben, founder and CEO of The Garage. I'm very excited about our guest today, Aric Coffman, who is the CEO of Honest Medical Group. And I've had the privilege of working with him the last few months. Aric, how do you see the opportunity? How do you see the challenges?
I think it really starts with a lot of misalignment that exists in the base healthcare system. And this became readily apparent during COVID of some of the fragility of a fee-for-service model that really put a lot of pressure, especially on independent clinicians, to be able to maintain their practices.
It's taking its toll on the system. The system that we have today to serve this population is just not sustainable, if you really think about it. And there's been talk about how the CMS trust fund is going to be insolvent by 2029. And what are we going to do to create a sustainable system where the things that we've worked hard on, they continue to create that experience? We have this posture of having a digital first, data first approach to value-based care. And when you think about it, right? If you're saying the realm of value-based care is I'm going to put outcomes as my leading indicator of change or leading indicator of service, how are you going to track outcomes? The only instrument you have is data.
They sat in a room together, and this was everything from law enforcement to the ER directors, to the ambulance company, to the care management teams, to the primary care clinicians, to come together and say, hey, look, in our community, these are the top 300 people that are using services at an unprecedented rate. Let's go through each one of these 300 people and let's talk about what we can do collectively. And so it was a joint effort. So, when you have the sheriff there and you have the ambulance company and you have the hospital and you have the ER director and you have the community clinicians and you have these other constructs together, they then can create the right interventions for those patient populations, working as a community to get that individual to be in the place where he wanted to be, but have the resources that he needed to actually be successful and thrive in that place. It took a village. It took the community coming together to make that happen. And when it did, the amount of savings that you had from waste in the healthcare system could fund programs like that and scale across multiple different geographies in the country. We're in a very unique time in our economic history of what's happening locally. We have a lot of things happening globally, and our ability to effectively lower the total cost of care by improving outcomes puts our people and our nation in a better spot. It puts our communities in a better position. It creates lasting happiness and joy in the world. And so I really do believe that the time is now.